Please put on the link. Good evening, everyone. Welcome to this. I think there's a feedback. Welcome to this short session from wherever you are logged in from. Please let me know. Trying to go on YouTube to see. I've not gone live on Instagram. Thank you. Good evening, everyone. Thank you for logging in. Please let me know where you are logged in from at the moment. You can drop your comments in the session on YouTube, and for those who are live, I'm just trying to make a connection right now. So today is a very special day. I have a question here, and I'm going to be talking about some things around the liver. So we are focused on this. And by the way, I created a group known as the Ask Dr. Rita Health Circle 2025. Now, this circle is for people who want to learn. I'm trying to put together everyone in a community so that it's a free group actually. Mostly my patients, and then even, but not only my patients. So anyone who wants to know more about their health and what they can do about their health um, should generally find themselves on that link. Now, there's a number that's going to be displayed on the screen that you can use to um, just send a request to that number so that you can be added to the health and wellness. So when there are videos, not health and wellness, the health circle, when there are videos, you can just um, click on the video and watch directly, streaming straight. Hello, Mr. Amadi. Welcome live on the video platform. So the purpose of that group, I was saying, is for the teaching on the liver, the kidney, and at some point I may add the heart. I mean, like the month of February, I'll be talking at some point about the heart. But the purpose is for people to know about their liver and their kidney. Now, why am I doing this teaching? In the last 5 months, the incidences of liver and kidney problems have become alarming. It has become alarming, and a lot of the times cannot hear us. Wow, people are saying that they cannot hear. Please, what's happening? Is that from me? From which platform is the person not hearing? Is it on YouTube? Can you respond? Is it on YouTube? Let the person write where they are not hearing so we can know what to do. It's important that people hear what we are saying, please. All right, Mr. Solomon, thank you very much. I hope you can hear me very clearly. Just drop a comment in the comment section so that I can know if you can hear me very well, because it's important that you hear me. So I was talking about that the purpose of this meeting of is re-echoing, okay? I think maybe you need to put off your, if it's re-echoing, that means you are logged on 2 devices. No. Is it better now? So the purpose of this teaching is to teach you about the liver. And I was telling you that the incidence of liver-related problem in the last 5 months is becoming alarming. And as some of us may know, on the 30th, 31st, and 1st of January, I will be in Lagos. For the publicity for this Lagos advert, we have received over 1,560 inquiries and bookings and interest. And I can say to you that over 60% of those people have a combination of liver related problem and kidney related problem. That is, people that have both liver and kidney problem joined together marks over 60%. Then we have those who have only kidney problem, and then those who have only liver problems. So we're looking at over 80% of this is looking at over inquiries of 1,560, and you have well over 800 to 850 people having liver and kidney related problem. Is the reason I decided to start doing this advocacy. So this is the second one that I'm doing. The first one I did was on safe ways to use herbs. You can find that teaching online. Now, these classes are going to be 1 hour, only 1 hour. And today I'm talking about liver. And I was making the advert for this. Someone asked me, the person said, Dr. Rita, you said liver disease and fatty liver. Does it mean that they are different things? The question was, let me try and read out the question so that I'll take it up from there. The question was, based on your write-up here, you wrote fatty liver disease, liver disease. Please, what is the difference? Please, are you people hearing me on YouTube? Mr. Amadi, were you saying something? I can't hear you. You need to type what you're trying to say. I can't hear you. Please type what you're trying to say in the chat box so I can read it. Those on YouTube, please, can you let me know if you can? Can you write on the group? Write wherever platform you are. If it's re-echoing, it's from your side. I don't have anything turned on here. And you are hearing me live from my device because you're on the live link. So maybe you are logged in on 2 devices. Mr. Amadi, please check your login. Maybe you are logged in on both YouTube and on the Google link. So some people are on the Google link, some people are on YouTube. Um, so the person asks if there's a difference. Now, there's no difference. So the liver is the liver. The liver is the largest internal organ. It is located in your upper abdominal quadrant from the left to the right. Slide like to this side. It has a lot of functions. I'm sure you know. Okay, thank you. All right, it's okay now. Okay, that's fine. So I'm sure you know what your liver does, but in case you don't know what your liver does, I'm sure you can read that up so that I can go straight into what I'm talking about today. So today I'm talking about liver disorders. And yes, fatty liver is a type of liver disorders. I wrote that because a lot of the most common type of liver disorder that people are experiencing is fatty liver disorders, but fatty liver disease. But fatty liver disease is not the only liver problem that people have. In fact, any disturbance that has to do with the liver is associated to be under the liver disorders. And there are different types of liver disorders. But whether it is fatty liver disease, so let me even mention some of the types, not all of the type of liver disorders that people can have. You know, there can be liver congestion, there can be cancer of the liver, there can be jaundice, there can be hepatomegaly, which is enlargement of the liver. There can be hepatosplenomegaly, which is liver and spleen enlargement. There can only be liver enlargement, which is hepatomegaly. And then there's also hepatopathy. There's hepatitis. Now, hepatitis is generally known as an inflammation of the liver. So anything that causes the liver to be inflamed is hepatitis. Now, I've done a video on hepatitis. If you go on the YouTube page, you will find it. Ask Dr. Rita underscore show. This page you are logged in from on YouTube, you will find hepatitis there. So I will not be talking about what I've talked about before. I won't be talking about it at the moment. You know, there is hepatic fever, cystic fibrosis, cirrhosis, there is, biliousness. So these are all different types of liver disorders. But what I want to focus on today is what is the most rising cause, or the thing that is contributing so much to a lot of the liver disorders that we are having, is fatty liver. Now, fatty liver is a condition where the amount of fat around the liver is more than 5% of the covering of the heart, not the heart, of the liver is covered by fat. Now, there are two types of fatty liver disease. There is the metabolic fatty liver disease, which is also known as the non-alcoholic liver disease. And then there is the alcoholic fatty liver disease. So there are two types. In my listing of talking about liver, I listed fatty liver and liver disease because fatty liver is a precursor to several other liver diseases. It is what now gives rise to other liver diseases in some cases. In cases like hepatitis, that is caused by virus, it's not because the cholesterol was high, no. That's because of an invasion of bacterial infection. In case of cancer, although when fatty liver is not well taken care of, as the liver cells degenerate, at the end stage, after it becomes cirrhotic, it could become cancerous. Yes, so you see, the one thing that sets, the way you arrange a pendulum or arrange a card, and the first thing you can tip that can move on to go and cause a bigger problem up. That's why I separated it, and then I'm addressing that, even though it is a part of the general problem, it is usually the beginning, the cause of several other types of liver disease. Now, incidentally, it may interest you to know that in cases of liver problems, the symptoms are not different from symptoms that somebody experiences. And that's why usually it stays so long before the person will know that it is their liver that is affected. Most times, if they're not even aware, they would be in most cases, maybe there are no symptoms. And then in other cases, while there are symptoms, the symptoms may not be different from what the person experiences ordinarily. Let me list out some of the symptoms that are associated with liver-related problems. You have fever. Fever is a type. Fever is a type of symptom that can be as a result of nausea, biliousness, vomiting. You see, these things are headaches. People will not easily think when they're experiencing this tiredness, dry mouth, bitter mouth. People will not know that they are little warning signs that the liver pain in the epigastric region, or pain to the right hand side of the abdominal cavity. The person most times will be thinking that it is ulcer. So we've had cases where the person is assuming that, oh, they are having ulcer. In some cases, they may be bloody stool. In some cases, the person may have loss of appetite. The person begin to experience weight loss. the stool becomes very dark. So, and then in some cases, after a while of the person maybe treating malaria or taking some pain relief, the symptoms may quiet down. You see, the person experiences dry mouth. Now, these are signs. Then the person's urine begins to change color. The urine becomes darker in color. The person is experiencing abdominal pains. These are signs. And if the person checks their cholesterol levels, they would particularly find that their cholesterol levels are elevated, particularly the triglycerides will be high. Triglycerides will usually be high. And then in some cases, the liver enzymes may be abnormal. Some of them may be too low, some of them may be too high. It may be a variation of both. The person may experience bad breath. The person may experience pain after eating. And then at some point, swollenness of the leg. The person is still not knowing that it is their liver giving them signs. And the person continues. So these things I'm listing out to you, they are things that people do that can give them problems with their liver. And I kid you not, the liver is the powerhouse of the body. In fact, I always say to people, I said, if you once people come to me and they're doing consultation and they say, well, I have this problem, and I'll tell them, I say, you don't have a problem. The person will be like, I say, you don't have a problem. Irrespective of how a challenge can be, I will say that one challenge that someone should not pray to have in their life is a kidney problem and a liver problem. Because when these two organs are affected, I mean, they are in charge of detoxification, they are in charge of hormone production, they are in charge of homeostasis, balancing of fluid in the body. Your kidney is in charge of that, removing of waste. Your liver does that, breakdown and absorption of nutrients from food, breakdown of drugs that you take. Your liver is responsible for that. Production of amino acid, your liver is responsible for that. Production and storage, processing iron of red blood cell, your liver is responsible for that. Cholesterol manufacture is your liver. Hormones, your liver is responsible for that. Storage of glucose, change of glucose back to insulin, insulin back to glucose, your liver is responsible for all that. You see, now, if this organ that does all these essential functions now begin to have a problem, you see that the person really has a problem. The problem becomes a big problem. So, not undermining any health condition that anyone has, but irrespective of the health condition that someone has to pay attention to be sure that their liver is well kept, their liver is not in distress. Now, what are the things that can cause the liver to be distressed? A lot of times, from my study, from my observation, especially for now, when we're looking at fatty liver disease, I said there are two types. There is the alcoholic fatty liver disease, which is caused by consumption of alcohol, which is caused by lifestyle, because the person has been taking alcohol, whether it is occasional alcohol or drink. The person takes any form of alcohol, can cause that. The person smokes, can cause that. You see, then there is a non-alcoholic fatty liver disease, which is very much common, which is what is now giving me concern, because people who are not smoking, who are not drinking, who are not who are health conscious, they are not in their own right, they are not doing anything. In fact, if for any reason, if you want to really look at, they are taking steps towards their health. Why then are they coming down with stage 2, stage 3, stage 4 fatty liver disease? Why? What is the lifestyle that they are involved in that is leading to this? This is what these meetings are for. Now, what are the things that people would be doing that can contribute, even though they do not smoke? One of the key things that, from study and observation, that is contributing now to fatty liver disease is sugar consumption. You don't take alcohol, but you take a lot of sugar. So before you say, I don't drink Coke, I don't drink Fanta, I don't drink this, I don't drink that, everything you eat converts to sugar. For your body to use it, it has to be changed finally to glucose. Now, when you are involved. And when your consumption is more than required, so let's even look at what is your daily requirement. Does your body require a 2,500? Does your body require a 3,000? Your caloric requirement, which is all the food that you eat, your energy per day. What is your requirement? That's where it starts from. Because if you are eating more than your requirements, it means that the tendency for your body to have excess of glucose in abundance, what if it is only protein diet you are doing or only fat diet, it is still for your body to use it for energy to still change into glucose. So what is the portion? What is your portion size that you are eating? You may be eating the right thing too much, and eating the right thing too much may be what is causing you to have excess. Now, this excess may be what is contributing to part of the problem. You see, so what is your portion size? That's the first point. We are looking at, for people who don't smoke and people who don't drink, how do you prevent your liver, take care of your liver? One, your portion size. Now, for you to know your portion size, you need to know what is your daily requirement. Your daily requirement is based on your body need. Your body need is calculated based on what, I think the YouTube has, okay, what work do you do? You see, how much energy do you expend? All these are what you need to know. You need to be able to determine your daily portion size. For instance, if you are dealing with a bone-related injury, you need a lot more of collagen, you need a lot more of bromelain, you need a lot, and you need to go and look for them naturally. So if when you know your weight, when you compare your weight with what you do, how physically active you are, those two parameters would help you to know what your daily requirement should be. So if your daily requirement should be a 2,800, so that is what your body needs, and you are eating 4,000, even if you are eating right, your tendency to have fatty liver is very, very high. So portion size contributes to non-alcoholic fatty liver. And we've been able to establish, go and watch the video that I've done, it's on YouTube, on fatty liver. You see? So that your portion size has been established. Number two thing, and you need to, I'm talking about care of your liver now, in preventing fatty liver. If you smoke, stop smoking. If you drink, stop drinking alcohol. That's it. Smoking and drinking will not remove the already existing effect. You need a therapy for that. But I'm now telling you what to do to prevent it from coming or prevent it from escalating. Number two, after your portion size, your next thing is your eating circle. Your eating circle can cause you to have fatty liver disease. Let me explain what I mean by that. The body works in cycle. There's a, the body works this way. Daybreak, night comes, your body follows that circle. This is why no matter what you are doing, when it comes to some time of the day, you start feeling sleepy at night. You start struggling to keep yourself awake because your body follows a cyclical pattern. It is in deep sleep and in sleep that your body repairs itself. Now, when you don't follow the cycle of life, and you say that I eat at any time, Nothing do me. When I eat at any time, I can eat 2 a.m. You may not have stomach pain. You may not have any problem in when people see you, you may believe that you are very all right until you will go on a random test and you just do a scan. The scan will just the scan that I'm talking about is not that thing that people will go to one place and they will hold their hand and not say they see your intestine, they see your this, they see you go and do a correct ultrasound. They will use that to check your organ. Go to a diagnostic center. I just needed to drop that, by the way, because people have come to me and say, oh, I went to do one test. They check my eye, check my this, check my that, say everything is okay. Then I send them to go and do a real serious diagnostic test, and they come back with very terrible results. So when I'm talking about tests, I'm talking about go to a diagnostic, correct hospital, correct lab, diagnostic lab. That is it. So you must have breakfast. You want to have non-alcoholic fatty liver disease, you must have breakfast. You must have breakfast. You cannot afford to say you are not eating. You eat once in a day. Once in a day is going to give you will tell that your cholesterol levels will not be regulated. It's of the function of the liver is to produce cholesterol. And when you stay for long and you are not eating, what does that do? This brain will receive signal from the stomach that there's no food. As your stomach do, you are hungry, hunger pangs. Immediately, what happens? The body goes into compensation to produce. That is why abstinence or I'm not eating. I'm yet to find someone who is not eating, who said, okay, they are eating once a day to be able to use to bring their cholesterol level down. It does not go down. It doesn't go down. You must follow eating cycle. If you are eating according to your caloric need, your caloric daily requirements, if your caloric requirement is 2,300, if you are eating 2,300, you will not be growing overweight. You will not grow overweight. You see? So you should follow. So I'm telling you things to do to protect your liver, things to do to care for your liver, things to do to avoid fatty liver disease. I've told you point number 2. Point number 2 is that your eating circle. Your eating circle. Starvation sets the body into a mode of preservation. When the mode of self-preservation, the body will break down, but your body will produce as your body manufactures cholesterol, because cholesterol is very important. Don't be deceived. The cholesterol is your hormones function with cholesterol. The problem is that when they become too much, when the body is producing so much and you are consuming so much, they now begin to store. They store in the arteries. They cause arteriosclerosis, narrowing of the arteries, which causes blood pressure to rise and not come down and cause other issues, numbness of the leg, tingling sensations of the leg. All these things are things that accompany very high levels of cholesterol in the body. The next thing again, apart from, so I've told you, I said your portion size, things to care for your liver. Number 2, have your eating circle, follow circle. Breakfast, have breakfast. Lunch, have lunch. Dinner, have dinner. Now, ensure that if you are concerned in caring about your liver, ensure that your heavy meal, move it to the afternoon where you are most active. Your vegetables, move them to evening, or your soups, your pepper soup and all about that, move them to your evenings. And then your fruits and your all about that, move them to morning. If you watch one of my videos that I've done in this month, I did a review on apple. So watch out for that video. From the video, from the review, I was telling why some people have serious heartburn from eating apples. Please watch out for that video. Apples are very good, and I really spent a lot of time talking about it. I even gave a 1 week therapy for people to do on apple pudding, and I did a video on how to do it. Watch out for the video. You can go to my page, you'll find it. So in preventing fatty liver disease, 1, you must know your portion size. 2, your eating circle. You must follow the circle. Nothing like I eat 3 a.m., I eat 4 a.m. You eat 3 a.m., you eat 4 a.m. It's not giving you problem now. The time you will find that is giving you problem, you will not remember that you are eating 3 a.m. Number 3 thing that can contribute are the supplements that we take. Now, I don't have a problem with supplements. I have a problem with the fact that people take supplements without running tests to check their body requirements. That's what I have a challenge with. I have a challenge because people are now a moving pharmacy. They are taking non-essential drugs. Non-essential drugs are drugs that you can do without, that you can get from food. Your food is your number 1 medicine. Now, all these things that you take, they cause the body, in the course of breaking down some of all these chemical things, these drugs that you are taking, they cause chemical reactions. Some of these chemical reactions trigger the body to produce more cholesterol than the body requires as some of their side effects, even though it is a supplement. So number 3, the supplementations that we are taking. Let your food be your supplement. I did a video, you can check it, A to Z of wellness. And from A to Z, I listed from number A, at least 10 fruits or vegetables that can give you vitamin A, vitamin B, from A to Z. It's called A to Z of A to Z. Health, A to Z of wellness with Dr. Rita, something like that. It's on this page. This page you are on YouTube that you are watching me. Go and look at videos I've done. So I did that video the last 2 years. I did that the last 3 years, 2020, 2023, last 2 years. I did that video because it was a birthday gift that I even did. Health and wellness, A to Z. Because I wanted people to know that everything that you are taking as a supplement, there is a natural source of it. That if you eat it with moderation, your body will take what it requires and pass out what it doesn't, especially for the water-soluble vitamins. The water-soluble vitamins, the body does not store. The fat-soluble vitamins, the body will store. Vitamin A is a fat-soluble vitamin. Vitamin D, vitamin E, vitamin K. You see, these are fat-soluble vitamins. So when you are saying, I'm taking vitamin A for this, I'm taking vitamin E for this, you're wondering why your cholesterol levels are not going down. Excess. So you need to look for the food source. It's the food source. And you see how these things contribute to your life, to how these things contribute. They contribute because it is a cumulative compound effect. So unless you have done a test and the test shows that there is a deficiency of a particular mineral, why are you looking for supplements for it? Unless you do a test and your test shows that you are calcium deficient, what is your reason for taking calcium supplements? You don't have a bone injury. Your test did not show that you are deficient. You just assume. Because fatty liver disease is a more serious problem than what you think you are trying to solve with taking supplements. Eat the natural source. Look for it. And eat it within the recommended, the recommendation that your own body needs. For instance, a young woman who is still giving birth or who is breastfeeding, she may need to, she doesn't necessarily need to take supplements. She may need to increase the sources of these vitamins that she's taking during those periods because of the extra demand that the body is placed on. But you that you are waking up in the morning, you go to the office, you come back, you sit down morning to night, Why are you? What is the purpose? What is happening? Because we are not looking at what we are doing that is contributing to this problem. We are looking at what is the thing that is the external factor. What about the things that you are doing? And I'm listing them to you. Supplements. So if you do a test and you find out that, oh, you are vitamin D deficient or you are calcium deficient, on that basis, if you are taking that, if you are now taking it, that is a different case. And what are you taking for? What is the duration of time? Sometimes some people are recovering from a long-term illness, and the illness has caused their body to really, really, really cause a lot of wear and tear in their body. That may make them have a need for it. That's a different case. Sometimes because of some drugs that some people are placed on, those drugs causes loss of some other minerals to make up for it. And even when you have made up for it, how do you know when you have made up for it? You have to check. So number 3 thing that you can do, that you need to do to care for your liver, is check your drugs and your supplements. Before you take any supplement, ensure that there is a test that shows that it is a requirement. Number 5 thing that you need to do to care for your liver are the um I'm trying to there are these vitamin therapies. Now, there's a difference between supplements that people take, those ones you take them as pills, and then there are other vitamin therapies that people do. People go to take some vitamins by drip into their, so that they will look fresher, so that they will look okay, so that now these IV vitamins, I'm not so much going to talk so much about it because, like I said, in supplements, these IV vitamins I'm referring to are these ones that people do as a beauty therapy. So maybe I should put it as beauty therapy, which includes vitamin supplements, which includes drugs so that their skin will glow, things that people rub so that their things will glow. Now, the FDA, the WHO, the NAFDAC has identified several things that people consume, chemical compounds that people consume, either topically, that means rubbing on their skin, IV taken as drugs, taken through their mouth, that goes to affect the liver directly. Your skin that you are seeing, so is a very large sponge, and things can easily penetrate through your skin. And when they penetrate through underneath your skin, you have vast amount of blood vessels that absorb the same way your body absorbs sunlight and takes it and convert all these things we rub. And not some, everything you rub goes into the skin. These things go and settle on the liver cell. And when they settle on the liver cell,
Your liver is cared for. Don't just assume. You see, don't just assume that because somebody is doing it, then it will be good for you. So I'm saying to you today, I've told you 4 things to do to protect your liver, to care for your liver. The first thing I told you portion size. The second thing I talked about eating circle. The third time I told you about supplements. The fourth thing I told you about beauty therapies and IV vitamins. In our next episode, which will be in 2 weeks' time by the grace of God, I'm going to tell you some other things. Maybe I'm going to be alternating liver, kidney. But I want to say to you, if you live in Lagos, I am coming to Lagos on the 30th, on the 31st, and on the 1st of February, I'll be in Lagos. You are not supposed to come and see me every day. Just choose the day that you want to see me. You need to only book for 30 minutes at the minimum. Some people have paid for 1 hour, that's fine. You come for your physical session. And I've said to them, whether you are in Lagos, whether you are not in Lagos, you can book a consultation. There's number on the screen. Reach out to me. Let us help you. But in the spirit of oneness and the spirit of health advocacy, I'm going to say the following test for you to go and do. Please note that you have done the test and you now send me result does not mean that I'm going to interpret it to you. No, this is me. This work I'm doing, this health education, this work that God sent me to do, to educate people, to teach people. I want people. I don't want to be seeing. Now I'm seeing children, 13 years, 15 years, 14 years are coming down with kidney failure. I'm not talking kidney end stage kidney failure, stage 5. Is part of why I'm doing all this. I'm seeing 15 years old coming down with fatty liver disease. I have twins. They are going to be 16 in a few months. Every child that comes to me, I see my children in there and I'm like, no, this cannot happen, not on my watch. That is why I'm talking today. And God is a witness. So I'm now telling you that these tests I'm even talking about, not just you check your children, let them check. It is important. Your child has been complaining of headache. It's not just fever. Tell them go and check their liver. So these are the following tests, and I'm going to be rounding up with this, and I'll tell you these tests that I want you to do. Please go to lab. They will take your blood. When you want to take your blood, you will not eat. Fasting test. Please go in the morning. They will do a liver function test. They will do a renal function test. They will do EGFR. They will do ESR. They will do a uric acid test. You will do your fasting blood sugar. You will do uric acid test. You will do HbA1c test. You will do an abdominal pelvic scan. I've listed 9 tests for you to do in this month of January. Don't say you don't have money. Go and check. Be sure when you do this test and everything is normal, kneel down and say, Father, I thank you very much. Just kneel down and say, Father, I thank you very much. Then take heed to the advice I'm giving to you. Me, I'm not going to come online and come and say, go and eat coconut for the liver. I'm not that kind of doctor. I give recommendation based on the need. I can talk generally the way I'm talking generally on the things to care for your liver, and yes, I can tell you things to add to your diet. But I'm not going to give you remedy without seeing your laboratory test or without knowing what is wrong with you. So, those tests that I've listed out, please try as much as possible to do those tests and check. Know your status. If you now want to know whether you are your nutrients, then go and do a mineral analysis. Those are further investigations that can be done. If you want to find, for some people that say, oh, they are always having pain in their gastric region, go and do H. pylori's test. Do a stool analysis. A stool analysis. Carry your stool, put inside, go to the lab, then put inside container, let them check your stool. Do a urinalysis. Let them check your urine. Your urinalysis, your stool analysis will check. It will tell you. These things are things that you need to know. Even if you want to use faith, maybe you will use the name of Jesus against the name of the thing that is wrong. So get knowledge. I hope that you have learned some things today. I hope that you have been able to answer the questions that were posed at me. I hope that you have seen you have seen the you have seen the things that you can do to care for your liver. If you live in Lagos, book your consultation session. Call the number that is showing on the screen right now and book your slot. The venue of our office where we're using is at Salvation Okpebi, Samuel Awoni, number 3, Samuel Awoni Okpebi, Salvation Road Okpebi. In number 3, Samuel Awoni close off Salvation Road Okpebi, Lagos. That's where we'll be on the 30th, on the 31st, and on the 1st. So please, the program is gradually rounding off to an end. Any question you have, you can keep it or drop it on the group. In the next live, we're going to take it. Mr. Chidi Amadi, I'm not sure I quite understand what you mean by fasting and food cycle, please. I'm not sure I understand that question. I didn't talk about fasting. I talked about eating cycle. So I talked about following the eating cycle. I'm sure if you're not very sure about that, you can watch the replay on YouTube. You will find it there. But I didn't talk about fasting. I said fasting blood sugar. If that's what you are referring to, the test is fasting blood sugar. So I'm not sure I understand your question on fasting and food cycle, please. It's not that question is not very clear. But if you watch the video, you can get the answer. I'm sure if you are referring to the eating cycle, I will not be able to go over that again because I don't want to exceed 7 o'clock. If you watch the replay on YouTube, it's going to be live, still remain on YouTube. You'll find it there. But I didn't talk about fasting today, but I did talk about eating cycle, which is that you must have breakfast, lunch, and dinner, and you must follow the cycle of life, day, afternoon, night. So not that in the night you are, so if you watch that part of it, you'll be able to understand what I've said. So I thank you so much for logging in to the live this evening. I'm sure you have learned some things. I'll see you by God's grace in the month of February. And if you live in Lagos, please ensure to be in the live session holding next week, Thursday, Friday, Saturday. We'll start from 9 a.m. to 7 p.m., 30 minutes per person. I'm sure you're going to have a nice time. And if you're coming, please come with photocopies of these tests that I've listed out. And as much as possible, ensure that the test is not more than 1 week from the day that you have found that you have done it. It's not 1 week, 1 month, not more than 1 month, especially because I want to see your liver test. It's advisable that it's not more than 1 month. Your kidney test is advisable that it's not more than 1 month. Your cholesterol test, lipid profile test. I hope I mentioned lipid profile test. Your lipid profile test should have been more than 1 month, interval before I see it. So I wish you well. Have a very pleasant Sunday evening as we prepare for the next time we're going to see. Thank you and have a wonderful evening. Bye.